One of the biggest fears patients have before joint replacement surgery is simple. How painful is this actually going to be? And honestly, that fear is understandable. A lot of people picture joint replacement as a major surgery with unbearable pain and a long, miserable recovery. But modern joint replacement has changed dramatically. I'm Dr. Donald Hope, board certified orthopedic surgeon specializing in hip and knee reconstruction surgery. And in this video, I want to explain what joint replacement recovery really feels like today. And more importantly, how we now manage pain using modern, non-opioid focused strategies. Because pain control is no longer just about giving stronger medications. It's about being smarter and more proactive at every stage of surgery. Let's start before surgery even begins. One of the biggest advances in joint replacement is regional and spinal anesthesia. Instead of putting every patient completely asleep with traditional general anesthesia, many joint replacements today are performed using spinal anesthesia, combined with targeted nerve blocks. What this does is temporarily numb the surgical area and reduce significant pain signals during and immediately after surgery. For many patients, this means less nausea, less grogginess, smoother recovery, and often less opioid medication afterward. Then comes the surgery itself. Modern, minimally invasive surgical techniques are designed to reduce unnecessary tissue disruption. The goal is not just to do the surgery. The goal is to minimize trauma to the muscles and soft tissues whenever possible. Less tissue disruption often means less swelling, less inflammation, and a smoother recovery process. During surgery, we also use something called periarticular injections. This is where a carefully selected mixture of medications is injected directly around the joint and the surrounding tissues during the procedure. Think of it as building pain control directly into the surgery itself. This helps reduce discomfort immediately after surgery and can significantly improve early mobility. Now, here's something most patients don't realize. Recovery itself plays a huge role in pain control. After surgery, simple things matter tremendously. Compression helps reduce swelling. Ice helps calm inflammation. Elevation helps move fluid out of the leg. And activity modification prevents overloading the healing joint too early. One of the biggest mistakes patients make is assuming recovery means either staying completely still or push through everything. Neither is correct. Recovery is about controlled movement. Too little movement can increase stiffness and slow recovery. Too much aggressive activity too early can increase swelling and pain. The key is guided progression. And finally, we use what's called a multimodal pain regimen. This is one of the biggest shifts in modern orthopedics. Instead of relying heavily on opioids alone, we combine multiple types of pain management strategies that work together. This may include anti-inflammatory medications, nerve calming medications, local anesthetics, acetaminophen, ice therapy, movement strategies, and carefully selected short-term pain medication when necessary. The goal is to attack the pain from multiple angles while minimizing opioid exposure whenever possible. And the truth is, most patients are pleasantly surprised. Is joint replacement recovery easy? No. There will absolutely be soreness, stiffness, swelling, and challenging days during recovery. But for many patients, the arthritic pain they lived with before surgery was actually worse than the surgical recovery itself. And the difference is this: recovery pain gets better. Arthritis pain usually gets worse. That's an important distinction. If you found this video helpful, make sure to like this video, subscribe to the channel, and turn on notifications, because I'll continue making educational videos to help you better understand joint replacement and recovery. And if you're struggling with hip or knee pain and wondering whether joint replacement may be right for you, contact our office to schedule a consultation. We'd be happy to help guide you through your options.